Thank you. Good afternoon, Prof. Rajiv and Prof. Afrin, also Prof. Henry from Indonesia, and also on the other of the great foot and ankle surgeon. So, first of all, I will introduce myself. My name is Yuda Manggala from Indonesia, and thank you for this opportunity to share my experience about treating deltoid ligament injury. So I will start from the basic, as we know that the ankle instability are among the common injuries presenting to primary care providers and emergency department. Ankle sprains occur at 10,000 person days, and approximately 2 million acute ankle sprain occur each year in the United States alone. And syndesmotic injury also the most commonly associated with extra rotation injuries and the mechanism. This extra rotation injury forces the talus to rotate laterally and push the fibula away from the tibia, as you can see in this picture. And the next slide is about the 22-year-old male patient with soccer player without any relevant leg problems with a Weber type C fracture. He got operation on August 2020, first operation I think, and he got ORIF for the fibula and also syndesmotic only screw for the syndesmotic injury. After 1 year surgery, the patient comes to our clinic to complain about persistent pain in the medial set of the left ankle. This radiograph shown that the decreased tibiofibular overlap more than 6 mm on AP view, also the increased medial clear space more than 4 mm, and increase the tibiofibular clear space more than 6 mm. This is the radiograph before he got the first operation. This is the result of the first operation. You can see this fibula was done by plating and screw, and then after that the syndesmotic injury was fixed with the screw, and then the problem after 1 year is the pain at the medial side of the left ankle still persists. And this is the second operation. When the patient complained about the pain of the medial side, I do some physical examination to confirm the pathology of the deltoid ligament, and the patient shows sign of the unstable medial side of this ankle. So I decided to perform surgery to reconstruct the deltoid ligament using the split posterior tibial ligament tendon, posterior tibial tendon transfer. We can see at the medial side, we can see the imaginary hole over there, and also the plate screw for the fibula fracture. This is the clinical picture of the left ankle. From the lateral view, we can see the scar after operation, also the medial view. So I make 5 until 6 incision to make tendon transfer, posterior tibial tendon transfer, rerouting to the medial malleolus. This is the CT image of the left ankle patient following the revision surgery. In this picture, we can see the hole at the medial malleolus like a tunnel at the axial view, also in the coronal view. This is the CT 3D. So from this article about deltoid ligament reconstruction, in this article shown some technique about treating ligament rupture, and one of them is to split tibial posterior tendon and attach to the medial malleolus. At the second technique. And then this is the medial side of ankle view, show the tibialis posterior tendon and the imaginary hole for the tibialis posterior routing. So after we perform splitting tibialis posterior tendon and insert to the tendon into the root from the inside lateral surface of the medial malleolus, then exit through the root, then suture to remaining the tendon to the. This is my drawing of surgical splitting posterior tibialis tendon and the root of the posterior tibialis tendon to the hole at the distal tip of medial malleolus. This is another article about deltoid ligament rupture in ankle fracture. This article compiled about 5 studies about ankle fracture, and all of them perform suture anchor to correct the deltoid ligament rupture. And the result The result of these 5 studies are written in this slide, but there is no clear or significant result about the deltoid ligament repair to the patient. But the only author that found a good result is the Wu et al. Wu et al. Conclude that the deltoid ligament repair will give a good medial stability for the result for the patient. Thank you.